Hi, everyone. Welcome, welcome, welcome. We are going to be getting started in 1 minute. Thank you guys for joining. I just want to make sure we have all of our panelists here.
Yes. So everyone's here except Zaire, and Zaire won't be able to join us, but he's here in spirit. Zaire is not feeling well. So our prayers go up to Zaire. It's been a long week for him. So a long 3 weeks. But
Gotcha.
we're thankful that he was committed to this opportunity. So I continue to check on him. Thank you so much.
Did you want me to keep the flyer up?
Yes. So as Dominique, I know, take over.
Hi, everyone, and welcome. Thank you guys so much for joining us. Right now, we are heading into our panel. Our panel on the transition experience of the resilient warrior, youth and youth adults living with sickle cell. And so we have the moderator, Carla Lewis, who will be moderating, Reagan Roque, who is a 15-year-old sickle cell warrior who, in spite of living with sickle cell hemoglobin E disease, enjoys living an active lifestyle and competing in sports. I apologize if I'm pronounced, I'm just going to say your nickname, Tilly. Tilly Tyler is a class of 2022 high school graduate on her way to be a future neurosurgeon / scientist attending Oglethorpe University this fall. Khadijah Tyler has sickle cell SS and plan on being a biochemist in the future to make more types of medicine for sickle cell patients that don't focus on pain. And without further ado, I would like to introduce the panel and the moderator. Carla, take it away.
Good to see everyone. Thank you so much for joining us today. And I just wanted to just take the time to say to our warriors, youth, adults, this is the day that you get to shine on continuously, but this particular day to explain your experience living with sickle cell and your transition experience. So I'm glad to have you, and I'm excited always about the youth panel, which I always decide to be the moderator for this panel because you take my hearts as I hear you talk about your experience, and I'm just overjoyed when I hear about the great things that you're accomplishing. So thank you so much. So we can spotlight now. So I just want you, in your words, to just introduce yourself and explain your genotype and one thing that's unique about you. We'll start with Reagan.
Hi, I'm Reagan. I'm 15 and I have sickle cell SE. And what was the question?
So we want you to say your genotype and then one thing that's unique about you.
Something that's unique about me is I don't let my sickle cell stop me. I use it as a way to show others that I can do things normal people can and that they can too.
Thank you. And the same question for you, Tilly. Just introduce yourself and your genotype and one thing that's unique about you.
Okay. I have, hi, my name is Amatula. I have sickle cell SS. And one thing that's unique about me is that I'm planning on being both a neuro and cardiothoracic surgeon on top of science. Yeah.
Love it. Love it. Great. And the same for you, Khadijah. Let's hear your genotype and one thing that's unique about you.
I'm Khadijah Tyler. I just turned 17 on the 23rd. And one thing that's unique about me, I would say, well, it's not a unique personality, but I have a very uplifting personality. Like, I don't like to let things get me down. especially during surgeries. I always try to keep a smile on my face.
Thank you. Thank you for sharing. And I just want to go into another discussion on just your experience with sickle cell. Can you share your experience, your first experience that you remember that you've had that you thought was a challenging experience, either having a complication, whether pain crisis or another complication with sickle cell? Can you share that with us?
So I would say my first major experience with sickle cell was probably my stroke when I was 7. I remember that my mom being 7 years old, I really didn't know what was going on. But now I have monthly blood transfusions to prevent another one. So that has impacted my life. So I would say that was the first.
Okay. And during that experience, can you share how you best managed to learn more how you could care for yourself during that time?
I don't remember much from that time,
Okay.
but after that, I really had to like do better with my health and stuff. I had to start taking different medicine. It wasn't always fun, but it did help me out in the end.
Great. Thank you for sharing that. And same question for you, Reagan. Can you share a time that you kind of remember as one of your most challenging times when you had to deal with sickle cell? And how do you best manage that time to care for yourself?
One of my hardest times when I was in kindergarten, and my parents and I didn't really think I was gonna have sickle cell complications. And one day I started having pain in my legs, and the nurse didn't believe me, and I didn't know what to do at the time. So they took me to the ER, and I was very scared because I didn't know what it was, what sickle cell was, how could it affect me. And how I deal with it is I try to think off my pain. I try to distract myself, like playing video games, or try to think that I'm throwing my pain away in a box.
Did Miss Lewis, you're muted.
You think I would get used to this. So same question for you, D. So that's your nickname. I'm gonna call you D. What is the most challenging time that you can remember, and how did you best manage that time with your care?
Me? Her or me? Matula or Khadijah?
Khadijah.
Oh, I already answered. Julie
Oh,
has
sorry. Sorry, Katula.
no, it's okay. I would say around the time that I really wanted to do sports when I was younger. I had a couple of pain crises, but a lot of them were really random and not often. But my mom did not want me to do sports because she didn't want me to risk my health. And I just didn't really like that answer. So I signed myself up for a lot of things, and she had to find out last minute. And that was really, really hard. She had to kind of let me do what I wanted to do in terms of my life, because I didn't want sickle cell disease to stop me from being able to do what I wanted to pursue. And at the time it was gymnastics. So I did my gymnastics, and even though, around that time I really didn't have any crises after gymnastics. But I think sickle cell really affected me because I felt like a lot of people were trying to help me from doing what I really wanted to do. And I just had to fight through that. So, yeah.
Thank you for sharing that. So one of the things that you shared was that it was a little challenging when you wanted to do some sports and activities, but you had to, you had to think about some of the limitations that your mom said maybe this might not be the best thing at this time. But when you signed up, you probably had some conversation with her in order to help motivate her and you to come to a point that you both can agree on. So I'm glad that you shared that, because as you know, I'm a mom of a sickle cell warrior, and one of the things that I know that my son really enjoyed was swimming. And we're in sunny Florida where it's hot, where a lot of children are swimming. And I remember when the school actually had what you had to do when he was in, I think it was first grade, he had to participate where they taught the whole first grade, he had to do a swimming class. But that was his joy. He already knew how to swim before that. But the challenges also had to make me kind of think about what to allow him to be able to do so in order to help him, because I didn't want to miss out on the opportunity of learning how to swim or getting better at swimming at the time. And having those important conversations with your parents when you want to do something, and your physicians when you want to do something. So that is so important, having that conversation with your parent as you go through this transition stage. I know it's very difficult when you remember the activities and things that you want to do and be involved in. And I think even for me, taking the time to even encourage those activities, right? So the next question that I have for you, during your transition stage, which is now, right? Part of your transition is now. What can you share? How has this particular time, even communicating with your health providers and communicating with your parent? I know that being either in high school or getting ready to go off to college, or everyone's in a different transition stage right now on this panel. How best do you feel that your health team and your parent is helping you prepare through these stages of transition? And I'll start with you, Reagan.
One thing is I've learned how to talk to my doctors, telling them what I feel when I had pain on this certain day, talking to them like what's the medication I take and what I might think I need, and telling them stuff basically my mom would have told them if I wasn't in transition.
Thank you so much. And can you just share a little bit while we're on you, Reagan, about your support as you do talk to your mom about transition and your pain? When you do maybe get into a crisis or feeling some kind of challenge coming on with your health, do you tell her immediately? Do you feel more comfortable waiting to talk with your doctor, or you have other family support that helps you when you need to talk about something like that?
Well, I usually wait to see if my pain will last, and if it keeps lasting and getting worse, that's when I would tell my mom, and then she would try to help me at home before she takes me to the hospital, and she would give me a medication, give me the stuff that helps me, and she usually just takes care of me every time I have sickle cell pain.
Okay. Well, thank you so much. Thank you for sharing that. And this question will be for Tuli. Tuli, the same question. Could you share your experience in transition? I know that you are getting ready to go off to college. So this is a total big step for you. And so during this transition stage that you're about to go off, what has prepared you? I know that Reagan spoke about taking medications, and now one of the things, well, you're going to have to also do is your refills. What has prepared you in order for you to prepare for this stage? There's some information that you probably have to know. What do you think has prepared you, and what is your support like?
Well, my mother has been preparing me since I was a young child. for transition. So first, since a young child, it started off with how can you describe what you're feeling, or can you just descriptive words, using descriptive words. And then we got more into technical, like terminology for actual things. And as I got older, since third grade, I've wanted to be a doctor. I've wanted to be a surgeon. So I taught myself a lot of things that I know now. And my mom taught me the advocacy part. And through the foundation, I've learned a lot about how to professionally speak to doctors and families and just professionals in general and people in general. And because of that, I've been able to, get to where I am now and understand what I need and get that across, as well as my mom is making me sign papers. So for myself, I don't like that. But everything else is okay.
Thank you. Great. Yes, I can kind of relate to that signing paper bit. The first time I was at a doctor's office and I gave my son the packet to now fill out. He was like, why don't you fill it out? So I definitely know that's got a little different, but definitely a journey of changes, right? And that's part of preparing and adulting. So I thank you, and I can definitely see that relation to what my son has to do. And yes, Khadijah, yes, the same question goes to you. During your transition, what has helped you for this stage? And I know there's certain things that you have to, they're kind of sometimes even with health professionals, and your mom might be wanting you to know, right, to prepare for you for this stage, because we tend to answer a lot of questions as caregivers, so now it's your time. So what has helped you and what best helps you?
Like Tilly said, my mom's been preparing me for the longest, and I would say more recently, she's just been like when we go to the hospital, she points certain things out and be like, okay, when you're at a certain stage, you'll have to do this on your own, or you'll have to do that on your own. She hasn't made me sign anything because I don't think I can yet, but she always had me use descriptive words too. When something goes wrong in the hospital, she's always like, Deej, how do you feel? She just to talk more about like how I feel after a certain treatment, and like if something goes wrong during the treatment. I don't think I'm that, because I don't want to be, but I know that the time will come, so I have to learn more. But I think I'll be ready.
Thank you for definitely sharing. And I know during this time of transition and during this pandemic, we had a COVID pandemic, and still in the pandemic, things has gotten a little better. During this time, has being in the pandemic made it difficult or change how you manage sickle cell? And what educational information can you share that helps you stay healthy or maintain your health that you have learned through this era of going through a pandemic? And that question will first go to we'll first go to Tuli this time.
Well, first and foremost, I would want to say that your mental health always affects your physical health. So if you aren't okay mentally, you will not be okay.
Further clothing and textile. You realize that I'm the manager.
Sorry, could you please mute your phones or your technology?
I'm trying to mute.
What?
Can you please mute? Thank you. Catherine, can you please mute everyone? I appreciate that. So thank you so much for sharing that. So I want to go back to you because I didn't hear you clearly, Tuli.
I said that first and foremost, your mental health always affects your physical health. So if you aren't okay mentally, you will not be okay physically. And because of the pandemic, I realized that a lot of people were, including me, just like going with the flow with a lot of things because, you know, if you have something to do, you're going to get it done, regardless of if you're happy or you're sad. And through the pandemic, because we have sickle cell, my mom, even now, she didn't let us go back to school when schools opened back up because there were a lot of COVID scares and she just didn't want us to get it and, you know, bad things happen and whatnot. But I realized that I have to work a lot harder. And if I get comfortable, things just won't get done. And I just had to make sure that my mental health was taken care of before anything else. I did my schoolwork, but I was also taking care of myself. You have to take care of yourself mentally, or else nothing's really going to get done because you're going to be, you know, in a state of
Stress.
stress.
Yes, yes. Thank you, thank you. And same question will be for you, Khadijah. During the pandemic, how has it affected you and, you know, the way you manage sickle cell or even the way your healthcare managers help you manage sickle cell? Can you share?
I don't really have a clear answer for that. I will say I noticed that not a lot of people do give blood, and that affected me because there was a blood shortage and I had to go back to simple transfusions. And while I was on transfusions, you know, my blood wasn't like, I forgot what happened, but I had to go back on my
Okay, she froze for a little bit, but she'll be coming back on. So we will go to you, Reagan, and we'll give her an opportunity to come back on. So Reagan, during this pandemic, how has it impacted you and the management of your health, and even with your healthcare team, how they help you manage your health?
It hasn't impacted me because
okay. Oh, sorry.
when I went back to school, every time there was someone who tested positive, I had to go home and quarantine, and I wasn't allowed to go back to school for a certain amount. So I had to make all that up, and I missed lots of school and all this assignments. And it also, I take supplements so that when I go to school, I can stay healthy and try to not test positive, and it helps me a lot with my pain as well.
Okay. Do you feel that during that time when you did miss a lot of school, that you got some support even from the school in order for you to make up your work that helped with you manage your schoolwork a little better? And how did you help to advocate for that also for yourself?
Well, the school didn't really help out much, and there's certain times where I was having pain and I should have been in the hospital, but they wouldn't let me leave school because I would have had to repeat the year. And my mom was trying to find a way for me to, if I can make stuff up again, and they were just being rude to her, telling her no, not wanting to help me out.
Yeah, that could definitely be tough as a mom, and I know your mom is also an advocate, sharing how you feel, right? And also for your mom to help to advocate, that can be very challenging and disappointing. Changing the methods of how that is, how things are done at school, definitely, I can see that writing letters and seeing on expressing how you feel about not getting the support, not only to the school district, but to your your school administration definitely would be helpful. It's very challenging, and these conversations are real conversations of what happens to sometimes in our communities to warriors. So thank you for sharing that. It was a tough experience through the COVID pandemic, it seems, for a lot of people, but particularly when you have to deal with the school not being able to help as much or be willing to help, and then you having to have the challenge of doing more in order to keep up with everybody else while managing sickle cell. This is certainly a challenge, but I know that you're a fierce warrior. And how has your year ended this year with school?
Well, I got caught up with all my work and passed all my classes, and I'm getting to move on, even despite all what happened this year. And I just been going to school in pain and just fighting through it just to get the day done, trying to get my work done so that I don't have to worry about it later.
Wow. We are so proud of you. We admire you. I admire you. I think that you are truly awesome. It takes dedication just to manage an illness, but now manage an illness on top of completing obligations of school. This really shows me just how much our community of warriors define the word warrior. You're just that and some more. Okay, Reagan? So I commend you for what you're doing. And tell us a little bit about your advocacy work in the community, because you not only manage school and work, I would like you to share some of the awesome projects that you have completed or what you have been involved with to highlight and educate on sickle cell awareness and sickle cell disease on a whole.
I have advocated for the Red Chair Project, and I am a co-founder of DFW Sickle Cell Kids Crew, and it's about, I like to, go up, talk to people that are like me, meet kids that are like me, understand me, knowing that when I have to like take a break or drink lots of water, they won't judge me or ask me why. They just understand what it's like to be me. We understand each other.
Mm.
And I like that, just hang around people with sickle cell, understand their experiences, understand how I can help myself or how I can help them. And that's one of the reasons why I wanted to be an advocate, to help others, tell them what I've done so they can do something that can help them.
Thank you so much, Reagan, for sharing that. And thank you for all that you do. Definitely, you're an advocate extraordinaire, even as a youth. Now, I can't say much more than that. That you're doing some awesome things. And thank you. Keep persevering through accomplishing your great goals and doing those great things, because our community understands and knows the challenges of living with sickle cell, but also the determination that you have to help others, just simply amazing. And Khadija, I know you got cut off when you was explaining a little bit, so we'll we want to go back to you so you can have a chance to explain the challenges that you've had through COVID. I remember you saying with the blood donations made it challenging through the pandemic for you. Can you continue to share?
There was a blood shortage, so I had to go back to simple transfusions. And while on simple transfusions, I had to start taking my medicine again. I was very compliant, and I was able to go back to simple. And now I'm off. But yeah, I just noticed that there wasn't a lot of blood to give to the people that needed it. So, we did some fundraising for that. Well, not fundraising, but we did advertisement for blood donation and stuff. And like Tuli said, mental health was really a big part of, staying on track, because, without the mental, you can't really get stuff done. And yeah.
Thank you so much for sharing that. The both things that you had mentioned, you and your sister and yourself, was that the mental health portion was so important. That is another portion that we know that when a lot of challenges, but particularly through the pandemic, we know our warrior community as well as the community as a whole definitely had some challenges. But I wanted to just go into, so even as a youth and a young adult warrior, managing the mental health is so important, as you mentioned. How best does have you been able to access resources that help you manage your mental health, whether it's learning to do different techniques or accessing therapy? Can you share a little bit, Khadijah, on what has helped you through the pandemic?
During a portion of the pandemic, we did do therapy, and I found that very calming, like just to sit down and talk to somebody about my problems. Another thing that helped me was writing stuff down, because, I was always a person that would like to take notes, but with, being in class online, they really skip through a lot of the stuff, so you can't really take notes. Just writing down stuff that I could remember from the classes, that would always help me, remember for, homework and stuff. And also writing down my feelings, which was also helpful. I got that through therapy. She was like, get a journal, write these down. And yeah, it helped out.
Thank you so much. And the same question for you, Tuli. What has helped you not only through the pandemic, because we know that mental health is so important overall. So what has helped you through your journey of living with sickle cell and maintaining your mental health abilities and being able to pretty much strive and thrive? And how have techniques helped? Have access to resources such as therapy been beneficial to you? Or have you gotten access to that also?
Yes, I was also in therapy throughout the pandemic. That helped a lot. But prior to, I realized that I would either suppress my emotions to get things done, and probably like reflect on it later, deal with it, heal, go on with life. But my therapist, she told me to take time out to just reflect after it happens rather than suppressing, because it's really not good for you guys. I would just say that, hold up, what was I talking about? We were talking about therapy. Yeah, therapy is good. No, but yes, I was in therapy throughout the pandemic, and I learned a lot of different techniques. Getting access to a therapist is a lot easier than one would think. It's just a Google search away, and they take a lot of insurances and everything like that. And I just would say that everyone needs a therapist. Everyone has issues. Everyone needs to talk it out. A therapist would help a lot of people, actually. So, yeah.
Thank you. Thank you for sharing that. And yes, access to therapy services is definitely important. And one thing that you mentioned is that anyone can benefit from a therapist, and everyone can, and everyone has difficulties that can benefit from a therapist. Yes, certainly. And we know sometimes there may be challenges or stigmas with therapy, but even for the community that's fighting any kind of chronic illness, including sickle cell, it's encouraged for our warriors in the community to definitely access therapy. It does help, it's beneficial. And so that same question that I asked Reagan, we want to hear about, you've done some awesome things, Khadijah and Tuli, in the community, doing some great work. So can you share some of the great work that you have been doing, and in order to educate, advocate, and share awareness in the community?
You want to start?
No, you can. Oh, okay. So, we're at an event right now. We basically go to events like, I don't know how many times, bi-weekly, sometimes 3 times a week. Yes, like honestly, whatever event needs sickle cell awareness, we go. Yes, we just advocate. We like giving our time. Our mom is like very heavy on awareness, and we like helping her out with it. We are co-founders, so it's pretty much our job. But yeah, she well, we go out to different events when we are up to it, because there was a couple events that Tilly was feeling sick for and she couldn't really come to. But I was still doing things for the foundation at home. We also do foundation work at home. Yeah. What I would say is right now, or after this meeting, we're gonna go out and educate a lot of people in our community about sickle cell and out of our community about sickle cell disease, because it technically is a rare disease. 100,000 people are affected by sickle cell. At least less than 100,000 people are affected by sickle cell disease in the United States. So at least everyone knows one person with sickle cell disease, but their experiences are usually, oh, they were always sick and then they died. You know what I mean? So you always hear, oh yeah, I had a cousin that passed away from sickle cell disease, but they don't go any deeper than that because they don't know any deeper than that. So what we try to do is educate people about sickle cell disease, and we also help families struggling with sickle cell disease and give assistance to families as well when they need it. So we do a little bit of everything. Yeah. So I think
Thank you.
Yeah.
Can you say the name of the organization that you are working with to share that wonderful awareness and volunteer your time as co-founders of this organization?
Yes, we are MTS Sickle Cell Foundation. My Three Sicklers. Yes. The founder's name is Mapiller Dawn. She's amazing. She's my mom. So yes, we try to help everyone, educate everyone, regardless of ethnic backgrounds, because everyone, regardless of ethnic backgrounds, can have sickle cell disease. So just the awareness portion is very important.
Thank you so much for sharing that. I want to leave time for the audience to also ask some questions. So I'm just going to jump in real quick. When advocating and thinking about helping others, and if we particularly if you had to speak to a warrior that wanted some resources in order to learn more about sickle cell and learn more about how to best treat their cells with their healthcare provider, how best can you be able to share some information about sickle cell and how they can best manage their care? And Reagan?
Ways I will try to help best manage their care or help them try to like learn about sickle cell. I'll tell them about the sickle cell convention where it be held, so they can go hear from professionals what it's about. And best ways I can help them is telling them what I learned from my clinic, trying to meditate or breathing or something to try to trick my mind in that I'm not having sickle cell. Like try to think off of it and like tell them like the supplements I take, things that they can take or ways they can help themselves. And that's basically what I would tell them.
Thank you so much for sharing that, Reagan. And I'm going to ask you a different question, and this question will be for Tuli. So as you have a support system, can you just explain how important it is to have a support system of a great healthcare provider that you can share with, as well as your family or a caregiver that helps? How has that helped you as you continue as a warrior managing your health?
Well, I would say that having a support system of both physicians and family is very, very important, because that can also affect your mental health and physical health aspect of your life. Say you're going through a physical, or not a physical, a pain crisis, right? And your doctor doesn't believe that or your doctor knows that you're going through a crisis, but doesn't want to help you or isn't listening to you while you attempt to advocate for yourself. In that moment, you're in a lot of pain. You can't really, you can speak for yourself, but you have a lot of things going on right now. And having a familial support system would help kind of take that stress off of you, as they would kind of try to handle it for you. And the physician aspect is, when you have a good doctor, you don't really feel afraid or nervous to go to the hospital and face challenges. So I would just say that it's really, really important. And it's helped me, because the last time that I was in the hospital, it was my first time ever having like a bad experience in the ER. I wasn't able to breathe. I was going through a lot of pain and my back was hurting. And a nurse told my mother that there are a lot of other people in here that need more help than I do, basically, or essentially. And then she walked away and started talking about my mother, who was trying to get me help. And my mom was handling it for me rather than me having to handle it on my own. And I felt really, really bad, but I feel like it would have been a lot worse had I had to handle that on my own. So yeah, I would just say that a good healthcare provider and a good support system is really, really important.
Well, thank you for sharing. And I'm so sorry you had to go through that experience. And we definitely know that there are challenges sometimes in the health system for supporting sickle cell warriors when they are in tough times of having a pain crisis or having a health challenge. And hopefully our advocacy, as we bring awareness and educate and literally point out the wrongs and encourage all the great things, that changes will happen. We're definitely on the road, advocates among the community, definitely on the road to making changes and letting our voice be heard. So I thank you also for sharing that, because it's important to know, right? It's important to know the challenges that are in the community, as well as you had to go through that tough experience. I commend you just for having a great mom to help you along that, but also for you understanding how important it was for your mom to help you through that situation where you didn't have to at the time. But now it kind of prepares your mind to understand what the community can or may look like on a negative note, but what you would have to do on a positive note to bring changes. So thank you so much for sharing that. And we hope changes are in the way. And I know your mom handled that well in the end. So thank you so much. So I want to know pretty much, this is my last question to wrap it up, because I'm giving it over to the audience to ask you questions. What would your advice be to a youth or young adult warrior in the community that may be having mental challenges and physical challenges dealing with sickle cell? What would your encouraging words be for them, Reagan?
I would tell them to not worry about it, that there's people, I understand, there's other people that understand, and tell them to take their medication, or tell them try to, meditate or pray to God, or ask like for help, talk to their parents or somebody they really trust. Go to therapy if they need it. That there is not all bad. There's going to be good days and bad days, but if you have the support, you're going to be in pretty good care.
Thank you. Thank you so much for sharing that, Reagan. That's some great advice. And the same question, I'm going to share that with Khadijah. So what advice would you give to encourage a young adult or youth warrior that may be in a tough time of feeling down physically and mentally? What are the words that you would share to encourage them in their journey?
It's always good to get your emotions out. So if it's emotional, I would tell them to either write it down, or try to find somebody they can talk to, whether it be their parents or someone that they're very close with. And if it's physically, it all goes back to mental. So you can always, there are always things you can do to help your physical. Like, for instance, if you have scoliosis and you don't really like your posture like that, you can always go get a back brace. I believe that they're paid for through insurance. So you can always wear your back brace. That's an example because my little sister has scoliosis. And you can always, talk about your physical challenges, because that also helps. Because it also.
Yes, definitely. Talking and seeking someone to talk to and even accessing therapy are great resources. Thank you so much. And the same question for you, Tuli. If someone's going through a tough time when youth or young adults, especially through transition, you went through a difficult situation in the ER, but I know that sometimes there are warriors that have challenges, maybe even missing a lot of school like Reagan did, or having tough time physically and mentally. What encouraging words can you give to that young youth or young adult?
Well, I would say that feelings are temporary first and foremost. So the feelings that you're feeling now, you might not feel in 20 minutes or even 5 minutes. And then second, I would say, life brings a lot of different challenges your way, and, you're equipped to handle them. They might be hard, but you'll be okay. You're strong enough to handle it. You can always handle it. And, if you're feeling mentally down and you feel like you can't, because if you're not mentally okay, you probably won't be able to feel physically up to do much. So I would just say probably write a list of like 7 things to do throughout the week. Try to do 1 thing a day. And then at the end of the week, reward yourself with something. It could be like candy, a trip, or, whatever you want. Just reward yourself. And then, it'll become like kind of like a routine. And then once you're physically moving, a body and motion stays in motion. And you'll get in the habit of just continuing on despite, your challenges. So just try to continue to move around and take your medication. Sickle cell disease attacks your organs and it deteriorates your organs. So your medication will preserve your organs and you need it. So just, if anything, just take your medication. You know what I mean?
Thank you. Thank you for sharing that. So definitely maintaining a routine and habits of taking your medication. We didn't get to go into healthy habits, which was one of the things I wanted to go into, but I'm leaving it up to the audience now to ask you and engage in conversation with you, this great panel, because we have some great questions that's always coming out of these conversations. So I will leave it to Dominique. If you can see any questions, definitely we can share.
I'm going to be asking the questions. This
Okay.
is Catherine. Yes, the audience wants to know, how do you determine if you tell your friends about SCD?
Okay, that's for you, Reagan, until the girls get to come back on.
I guess I'll tell them if I take it. I just tell them what I take, because if I go over to my friend's house to like hang out or spend the night, like I just tell them and their parents so that they would just know. I'm pretty open about what I take with my friends. I don't really have a problem telling them.
Okay, I'm gonna reframe the question. So when do you tell your friends that you have sickle cell disease?
Right.
When I usually tell them when I say something like, "Oh, I can't hang out because of this," and I'll explain to them because I have sickle cell, or like sometimes I get invited and it's like a pool party, and it's like I can't go because I have sickle cell disease and it could trigger me, or like when they want to like eat a bunch of junk and stuff, I tell them, "Oh, I can't. I have sickle cell disease and it could affect me." I tell them when my health's in danger, because, or like when it could affect my health, or I can have a sickle cell crisis because of it.
Okay, thank you so much for sharing. I know that sometimes can be difficult. So any more questions? And we'll
Also,
take the
yes. And they want to know if you do anything special before or after playing sports to prepare.
Okay, so I know that it was Khadijah that was playing sports, I believe, right? Or Tuli. Okay, Tuli. So Tuli, that question goes to you. So do you do anything particular, special to prepare for sports?
Honestly, I just drink a lot more water than I do naturally. So I don't know, prior to sports, I always get really excited. So my adrenaline is already high. And then I just drink a bunch of water, and then I just go do what I have to do. And then afterwards, for the soreness, I couldn't take an ice bath. I wanted to take an ice bath. And then my mom she explained to me why I couldn't. And my mom was like, she's right. And so I just took a hot shower and then stretched. So yeah. Nothing really. You just have to make sure that you have extra self-care afterwards, and then prepare yourself prior to.
Awesome.
Next
Okay.
question. What role, if any, did your medical teams play in your transition to readiness?
Wait, is that question for me?
That's for anybody who'd like to answer.
Okay. My healthcare provider, I've had him since we were around 7, 8 years old. Dr. Brown? Mm-hmm. Yeah, he's been with us since we were like pretty young children. And he also encouraged us to use descriptive words, and he encouraged our independence in the medical sense. So yeah, he's just always been really encouraging of the growth process, and hey, as you get older, you have to start, branching out a little bit more, because once you turn 18 or, graduate high school or whatever the case may be, you have to, go to adult hospitals, and you'll have to do it on your own. So he's just been really encouraging of us since we were young kids, along with our mother. So yeah.
That's awesome. The last question, I believe, is, do any of you have summer jobs? Does your employer support any accommodations that you may need?
Well, we both had a summer job last year. This year I'm interning. But our employers were really thoughtful, actually. We inform everyone that we meet prior to, hey, I have sickle cell disease, and explain it to them, especially if it's like school or work related. It's just a nice heads up. And sometimes, reminders, there's nothing wrong with reminding people. So they've always been so kind and thoughtful, making sure we drink water, making sure we eat. Yes, they were all really, really kind and thoughtful. So, yeah.
Thank you. This one other question I thought was important. have you all ever considered mentoring young warriors? So Reagan, we'll go to you first.
I have. My little brother has sickle cell too, and I mentor him a lot because I understand what it was like growing up with sickle cell, and I had no one besides my mom, and I want him to have somebody he can talk to about his problems, anything, try to help him, teach him ways to avoid having pain, and I just like helping him out. It makes me feel better about myself that he's not going through what I go through.
Okay, great, thank you. And that question also goes to Tuli and Khadija. Have you ever think of mentoring?
I haven't really given it a lot of thought, but I will say I'm kind of the same way with my little sister. In the sense of getting her to take her meds, putting her back brace on. I know that down the line, if she doesn't, it'll be tougher for her. Yeah. So I really try to get her into the routine of doing it, even though I have to keep reminding her. But I know that one day she'll get it.
And as for me, I've thought about it because I realize that a lot of sickle cell children, as they get older, my doctor told me there's going to be a phase in your life where you're not going to take your medicine. And that was around my sports phase. And I was like, I'm completely fine not having any sickle cell pain crises, right? And I'm like, I'm doing perfect right now. I think I won't take this anymore. So I didn't realize until I think about last year, the year before last, the reason that stage happens is because we aren't informed why we're taking this medication. And,
Wow.
All you hear is, oh, well, it's going to make you feel better. It's going to keep your boo-boos away. Not a kid. I might be a kid, but children they're curious. You know what I mean? And if you feed them, of course it's true, but the information that you're giving them is true. But at the same time, you have to
back it up.
Yeah, you have to back it up with information. A child's, why is the sky blue? Because of solar, you have to you're gonna be because of the sun. Why is the sun that color? Why is it doing that? They're gonna want in-depth question, answers. And if you're just giving them this plain and flat, it's gonna keep you healthy. That's not, that's not nothing. That's not anything. So, if I were to mentor someone, I would tell them exactly why. Your organs are deteriorating every day. You know what I mean? You have organs. Your organs look like, probably, depending on how sickle cell disease affects you, you probably have organs that, you might have to have a transplant, or, when you're older, or, you might have complications, or kidney failure, or, you might have to get a liver transplant, things like that. Sickle cell disease attacks your organs. It attacks a lot of things. You might not be getting enough oxygen in your body. None of us, sickle cell disease patients, don't get enough oxygen in their body. And it can affect the brain, and it definitely affects the brain. It definitely affects the organs. You need in-depth answers to these questions. Children aren't dumb. They want answers, and they're going to try to find them. And if they're not getting what they want, they're just going to be like, okay, well, it's not doing anything. So why do I have to take it? You know what I mean? And then when people are yelling at them, I was yelled at, and I'm just sitting here you didn't explain it to me, did you? So how can you be upset with me when you're not explaining what I'm taking? After a while, it's just you just want me to take this for nothing. So explain to young children exactly why they're taking the medication. And I do this with my little sister. If you don't take your medication, your organs are going to get bad. If you don't want to wear your back brace, I can show you, because I want to be a neurosurgeon when I get older. I used to watch these videos all the time. I can show you what it looks like when they straighten your spine. You know what I mean? And I just feel like you have to explain to children exactly why they're taking what they're taking, and exactly why they're doing what they're doing, because they're curious. And if you give them a simple answer, they're going to be like, oh, okay. but they're obviously going to want more. You have to give them more than that.
Whew, I can talk to you guys all day. Seriously, you have well informed us just on the journey, your journey, and you made some great points, Tilly, on just sharing information and educating for you to become well informed, right? And that's what you would do as a mentor to others. And yes, we know that, you know, even as a mom, I know telling my son to take his medication has been a while back that I have to keep on continue to tell him, and we have these conversations of what is sickle cell, what is the complications. We always have to have that conversation, and it's so important. More so, you explaining this makes me know much more why it's that important. So I thank you for sharing that, because I never, as a parent, want to neglect doing that also. So thank you, because you're helping me too. You're helping me. And I think you guys would be a great mentor to others, and educating and sharing your experience, and definitely us to have more conversation on what is important for you as you manage your health, right? And this conversation today was just remarkable for me, just understanding even more about sickle cell, and I'm sure with our community, from the aspect, the patients, right? Our young adults and youths that have sickle cell. So I thank you today. I think this was amazing discussion, and I think some of the comments is good points. I love what you're saying. Even children need to know and understand the why. You got to give them food for thoughts, and just simply, I love them, was one explanation from Ebony, which is also a mom with sickle cell, would have a child with sickle cell disease, and Dominique, amazing panel. So we have so much that have made statements that say that you guys are amazing, amazing. Thank you today for this talk. It is now lunchtime. We went over a little, but what you say is so important. It's worth it. Thank you for joining today. I appreciate this entire panel that was included today. You are remarkable. I admire you. Keep striving, doing great things, accomplishing your dreams, and even through the challenging times, use those times as experiences to get to the next level of what you want care to be for yourself and others. I know that what you've been taught, you have it within you. Thank you so much for joining, and we're going to continue to educate and advocate as a whole, as a community. Thank you so much. So at this time, we're going to break for lunch, and you can take this time to even join conversations, and feel free to say hi to our panel youth and send them a message through the app. They're actually being monitored also, so definitely say hi to others and meet others, engage. We thank you. Take this time to relax, eat some lunch, and we will see you again at 1 o'clock. Thank you for joining us.